Hello again, I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist, pelvic surgeon, and specialist in female pelvic medicine and reconstructive surgery. And we're talking about prolapse again today, and we're talking about how prolapse is treated. We talked earlier about the fact that prolapse is a turning inside out of the vagina. The vagina is essentially falling down, much like you can imagine a flag on a flagpole. If you cut the rope that holds the flag up, the flag falls down. If the vagina falls down in that way, the way you fix it is you pull it back up into place. So, first treatment for prolapse, which if it's life-threatening and you're seeking treatment for it, the first treatment could be non-invasive, and that involves the placement of a pessary, which is a small device that can go inside the vagina to hold it up. Many women don't opt for that device because you have to change it and clean it, and it's really intensive to maintain. Many women who seek a more definitive solution, and that solution is a surgical procedure designed to pull up on the vagina and straighten it out again. These procedures can be done through the vagina traditionally in the remote past, and still currently it's done through the vagina. However, the most durable, gold standard way of treating it is abdominally, using a graft to pull up on the vagina and straighten it out. Those grafts of late are being placed laparoscopically or robotically, and they're quite durable. And the procedure lasts a long time with low complication rates in the right, experienced hands. Here at the Pelvic Floor Institute, we've developed a method for using your own tissue, harvesting and using your own tissue to make the graft so that we have a mesh-free solution to your prolapse repair that does not involve the use of any synthetic mesh. That can be a very durable, long-lasting procedure. We've done hundreds of these procedures on our patients here in Tampa Bay with great success rates and durable outcomes. So if we see patients from around the country, the United States, and around the world for this, and many of our patients express great relief at the fact that they can have a non-mesh solution that's durable for their prolapse repair, such that the repair is long-lasting and does not recur. So I'm Lennox Hoyte, MD. Thank you so much for watching. We appreciate you coming by, and we hope we'll talk to you soon on another topic. Take care.
So usually you treat prolapse in a variety of ways. One is to actually do nothing. Sometimes prolapse can be safely ignored. I certainly recommend that a woman have the prolapse evaluated by a physician to make sure that it can be safely ignored. Sometimes if the prolapse is of a certain type, and the pelvic organ muscles are in place in a way that can support insertion. A device called a pessary can help to hold the vaginal contents in and prevent the prolapse from recurring. Those work reasonably well in women with intact pelvic floor muscles. Otherwise, the treatment for prolapse usually is a surgical involvement that involves pulling the vagina back into place and holding it in place either with stitches, as in a native tissue repair, or using certain kinds of augmented materials that can help hold the vagina in place.